into a little bit of what you need to strengthen. So we cover what you're going to foam roll, we cover what you're going to stretch. We can do those in some nice little supersets. Now we'll go into what we want to strengthen. Now, we're going to run through this as if you're going to put it together one exercise right after the other. You can complete that whole little superset, then loop back around and do a whole nother round. 2 to 3 rounds, 15 minutes by the time you throw this all in. There's a little low back strengthening program. You want to run me through? Sure. I'll demo it through. We're going to go glute marching.
Yeah, so the first one we're going to do is some glute marching. Again, initiating movement from the glutes is important. These are some of the biggest muscles in the body, okay? And if we're only doing things with our quads and we're ignoring our glutes, we're neglecting half of our musculature in our lower body. So when we're doing our glute marching, we want to first tighten up the abs, all right? Make sure those abs are really set. We want to pull the toes up off the ground. This actually helps to use the glutes a lot more than the hamstrings. As we lift the hips up, we want to focus on pushing the foot kind of down and forward, not pulling it back to ourselves. Because again, we want to try to use the glutes, not the hamstrings. So we go up, hold it up there, and then we march. One leg up, then the other leg up. We do these nice and slowly, especially as you switch sides. You want to have a couple fingers on the front of your hip to monitor that hip so your hip isn't dropping as you lift the leg. We've got about 10 repetitions on this on each leg, really monitoring that hip, making sure as you lift the foot up off the ground, the hip does not drop of that foot you're lifting. So about 10 of those. Then we come up and we're going to do some one-legged RDLs. You can grab a light weight. And then if you look at him from the front first, when he goes onto his one leg, which is going to be his left leg, notice how he did not tilt to get onto that one leg, but instead he shifted his hips over to the side. That really works on the glute med, the gluteus medius, that side hip muscle, and then we go down. So we have the weight in the opposite side of the leg that we were working. We're working mostly the left glute right now. Just tipping forward, notice the straight back. He's not reaching for the ground, he's tipping forward by pushing this leg back. If you have a mirror in front of you, you can take a look at your knee, making sure the knee's not falling inwards. You want to keep the hip, knee, and ankle in a straight line.
You don't really need a heavy weight for this at all. It's definitely much more of a concentrated movement than anything else. And that's very nice.
Good. Now we've got an exercise that we use a lot in physical therapy, but if we're able to take this exercise, modify it just a little bit, we can make it a very good strength and conditioning kind of exercise. These are called bird dogs. So what we're going to do is go down on the hands and knees. If the hands are directly under the shoulders and the knees are directly under the hips, this is a fairly easy exercise. So what we're going to do, Vito, is kick your right hand out in front of you and your left leg behind you. So we're just going to stay on this one side. Bring it in, touch the hand to the knee, or the elbow to the knee, and out, and in. Notice how his low back, when he sticks his leg out, this low back stays still. It doesn't move anywhere. All right, now let's modify that just a little bit. Take your hands out just 3 inches. Now take those knees apart just a little bit more, about 3 inches. Now we're going to do the exercise again. And just having that wider base of support, your gravity's pulling straight down, you now have a much more greater load across the body. This works the spinal extensor muscles, it also works the core. Not only your six-pack muscles, but the really important obliques and the transverse abdominis muscle.
That's a big difference.
Big difference, huh?
Big difference.
And if you needed to take it even further, say you don't have low back pain, you're a higher level athlete, you can go down, wide stance, push-up position. Right there, not letting that lower back move at all. But definitely if we're trying to rehab a current injury, we would want to start with the hands and the knees right underneath the shoulders and the hips.
Let's go internal stabilizers. You want to go pulses?
Yeah, we can do those.
We'll show them band and medicine. Okay. As far as when you're hitting it with the band, you want to grab a band, you want to make sure it's directly out from the body. Nice hip squared position. We're going to have enough tension so that at the furthest point here, there's still tension. It doesn't go slack on you, so you might have to find your spots. Right here, I've got enough tension. And I'm going to keep it right in this range of motion. I got no hip moving. It's all my internal stabilizer, my spine staying nice and still. And as you progress, you can always just pick up the speed. Right through there. not allowing the hip or anything to do any of the work. It's all coming from internal stabilizers.
You could even progress this to a small squat. As you're squatting down, you're doing your pulses. Even a smaller squat than that, just squatting up and down, just to train functionally as you're keeping your core really tight.
Show them with the mid ball.
Okay, so with the medicine ball, you got to go a little bit quicker because we got to create momentum with this ball. So you're right here, just taking the ball all different directions, all the way around. Again, you can squat and do this, going all the way across. You can get it down into a lunge. One full range, all over the place quickly. But again, the first one, just to start right here.
And what do you recommend, about 30 seconds?
About 30 seconds on that's good. You know, take it easy on the,
yeah,
up to a minute. Take it easy on the first couple days, and then progress as needed.
Okay, let's address strengthening mid-back and rhomboids so that we can get those shoulder blades back.
So the reason we need to have the upper back strong is because when we're typing all day, those muscles get lengthened and they get weak, and that's the common postural syndrome that I see. Tightness in the front, weakness in the back, pulls those shoulders forward. The head then has to compensate, so now we have a forward head. So we got to work on it from the bottom up. So working on the low back first, mid back, now the head posture. So we can get a weight for starting off. Stabilize yourself on the bench. Keep that lower back really still. Shoulder comes back. Let's start over here. Shoulder comes back first, pulling to the hip, back underneath the eyeball. Like that. Notice how my shoulder blade is not drooping forward. I'm not reaching for the ground and rotating my body. I keep that back, pulling there, not looking forward with the head, but keeping the head in line with the spine. If that's easy, we can then go into unsupported one-arm rows. I've got a lot of weight on my right glute. Again, pulling that shoulder blade back behind the body, not letting it droop forward. All right?
Nice. Okay, so we went through, what, 4 moves there? We went through marches. We went through, what came after marching?
The RDLs, one-legged RDLs.
RDLs, perfect. Then we went pulses.
Pulses
and
with the band and the medicine ball.
Perfect, and then we hit one-arm rows. So that's about 4 moves right there. 4 moves, run through those as a nice little superset. You can go time, you can go rep, depending on what you got. But 2-3 times through that round, that's a nice little back strengthening regimen to start out with right now. Maybe we'll, in the future, we'll progress and add some more onto this. Let this kind of come out. Some easy tips as well that you can just use in your day. Whenever you're driving, think about engaging the core and pulling that in. Stop the slouching when you're driving. Start to sit up a little bit more. In the workplace, we all sit on our chairs, and that compresses the low back. What you want to start doing, what I definitely do, and it's made a difference with me, is I sit on a stability ball. It's keeping the discs moving all the time. It's keeping the back from compressing. Nice little easy tip right there. If you are dealing with some current low back pain, or just pretty much all the time, we'd recommend definitely some Moxer. It's got a little natural anti-inflammatory. It helps keep the inflammation down in the body, which is going to definitely pay off. And what was our, little massage therapy and body work, 1 to 2 times a month. Definitely helps get deeper than what you can do with foam rolling and stretching and whatnot. Those are some of our basic tips. We want to see you guys living pain-free, because life's in pain and not having fun, and if you're not having fun in life, what are we really doing, man?
Yeah.
So, Paul, thank you so much.
Thank you,
for coming
I
out with
appreciate
this.
it.
And guys, stay healthy, stay fit.